Supplement plans are boring. They just are, and anyone telling you different is just lying to you. And here's why that's a good thing. As people decide on how they will cover the gaps of original Medicare, they're presented with the options of a Medicare Supplement Plan or a Medicare Advantage Plan, and told to pick one or the other. Everyone wants the coverage and freedom of a supplement plan, but at the $0 cost of most Advantage plans, including all of the other perks like prescription drug coverage, dental, vision, hearing, gym memberships, and the other things that are included in Advantage plans. Unfortunately, this arrangement does not exist, so you're left with the choice of a supplement or an Advantage plan. This video is dedicated to the Honda Civic of Medicare plans, the Medicare Supplement Plan, so let's talk about why it's boring and why that is brilliant. Now, admittedly, there are a few aspects to these plans that are not boring and will actually add some drama to your life, so be sure to watch until the end to see what those are. To set the stage a little, and so this video doesn't turn into an hour-long ordeal, I'm gonna preface this by stating that I am talking about two specific situations. Number one, this will describe life on a supplement plan, not the process of getting one or switching from an Advantage plan to a supplement plan. The second particular here is that I will be referring specifically to Supplement Plan G. We have several videos on our channel that talk about Plan N and High Deductible Plan G, but Plan G is king right now in terms of being the most commonly chosen, and it's really not close. So for this video, I'll strictly be referring to life on a Plan G. So why am I saying that it's boring? Because Supplement Plan G just works. Just like the Honda Civic, it may not have all of the bells and the whistles and the flashing lights, but it works. You know it'll start, you know it will run probably as long as you do. It won't win you any beauty pageants or drag races, but it just works. Here's what I mean. Let's take the plan itself, Plan G. Plan G is standardized across the country. This means that your Plan G, wherever you live in America right now, and with whatever insurance company that you picked, has the exact same coverage as someone else's Plan G on the opposite end of the country with a completely different insurance company. As with any shopping experience, it's easy to get overwhelmed with choices, and Advantage plans can do just that. Different copay amounts for different services depending on the plan, different coinsurance amounts depending on the plan, different out-of-pocket maximum amounts depending on the plan, and all of those change based on where you live. So for some, it can just be too much, and they just want to know which Advantage plan is the best and will be the best moving forward. Well, that's impossible to answer. Supplement plans keep it simple, and at any given moment in time, we can look you in the eyes and tell you, if you became Medicare eligible in 2020 or later, look, right now, Plan G is the plan with the most coverage, and it will be for the foreseeable future. It saves a lot of brain power and hassle for everyone. Speaking of saving brain power, Plan G only has one number that you need to keep track of when it comes to your out-of-pocket responsibilities. If you use healthcare in 2023, that number is $226. 226 is the Part B deductible, and it's the only out-of-pocket responsibility for the entire year that you would have with Plan G. So if you have a surgery or two surgeries or 100 surgeries in a year, as long as they are approved by Medicare, you just need to worry about $226. Isn't that boring? Won't you miss the math exercise of trying to figure out how much your coinsurance is going to be or how much you have left in your out-of-pocket maximum? That was a little unfair to Advantage plans. Your carrier will provide this for you, but still, there is a lot more math involved with Advantage plans than there would be with a supplement plan. All right, the second way that supplement plans are boring involves their predictability when it comes to what they will and will not pay for, because if Medicare covers it, your supplement plan covers it. If Medicare does not cover it, your supplement plan does not cover it. And that's it. That's all you really need to know. You don't have to say anything else about it. See, isn't that boring? As long as you're covered by Medicare, you don't have pre-authorizations, you don't have denials, you don't really have any excitement in your life. Your doctors and nurses are kept from all of that excitement as well, because most providers prefer working with original Medicare in a supplement plan because of how easy and predictable they are. Speaking of providers, the third and final way that supplement plans are boring, before we get into the exciting parts, would involve the network of doctors that you have with a supplement plan. Or rather, I should say that you don't have with supplement plans, because there is no network with supplement plans. Any provider or facility that participates with Medicare anywhere in the country will accept and be covered by your supplement plan. Now, that is not 100% of all providers and facilities, and to understand this better, we need to understand how provider contracts work. See, we're starting to get more exciting already. There are three buckets of providers. The first bucket participates with Medicare. They accept the Medicare payment schedule as full payment, and you're good to go. This makes up 97% of all non-pediatric providers. The second bucket does not participate with Medicare. This means that they can accept the Medicare fee schedule as full payment, but they don't have to. Quick tip, they usually do not accept it as full payment. However, they are only allowed to charge 15% more than what Medicare will pay. This 15% is called an excess charge. Providers in this bucket make up about 1 to 2% of all non-pediatric providers. And without a Supplement Plan G, you would be responsible for the 15% charge. But because we're talking about Plan G in this video, it makes it even more boring because Plan G covers this excess charge and you don't have to worry about it. The third bucket of providers are those who have opted out of Medicare. They do not accept the Medicare fee schedule as full payment, and they can set their charges wherever they want. It is a private contract between you and this provider. There are several specialties that make up that 1% number. The biggest group of specialists would be psychiatrists. So wrapping up the boring supplement plan network, or lack thereof, with a Plan G, you can visit 99% of all providers across the country. Whether you are traveling or maybe you live in one area for part of the year and then you live in another area for another part of the year, it doesn't matter, you're covered. All right, let's add some drama and intrigue, shall we? We can't have these sounding too lame. The three dramatic pieces of supplement plans, just like the rest of life, all revolve around money. The first is that supplement plans cost money. They have premiums that you have to pay every month to enjoy the predictability and stability that we've spent the last few minutes describing. Those premiums are higher than an Advantage plan. Those premiums are per person. So if you and your spouse want a supplement plan, you each have to pay a separate premium, and your supplement plan only covers you while your spouse's plan only covers him or her. Also, these premium amounts vary dramatically based on where you live and which insurance company that you choose. So there is some research to do, or you can just work with an agent, but know that premium amounts vary. The second drama piece is again related to premiums, and that is that those premiums will increase over your life. In most states, supplement plans will increase up to twice per year. Once would be the normal annual increases that all insurance plans experience often. Not necessarily every year, but most years your insurance premiums will go up to account for inflation and rising healthcare costs. Think of any insurance plan that you have. Back when Medicare first started, as an example, Part B premiums were $3 per month. Now they're $164.90 per month. Insurance premiums increase over time. The second increase happens on your birthday. Supplement plans are usually age-based, meaning that a 66-year-old's premium will be a little bit higher than a 65-year-old's. So every year on your birthday, you will see what we sarcastically refer to as a happy birthday increase. This isn't fun, but it's how most work. Now, there are certain states that do not allow this happy birthday increase, and certain plans that are called community rated that do not have the birthday increase. They will have that first increase to account for rising costs and inflation, but they won't have the birthday increases. Typically what happens is that these community rated plans have slightly higher base premiums. Also, the insurance company you choose matters. While the coverage is the same, the rate and the rate increases are not the same. There are carriers out there known for offering really low introductory rates, and then we'll hike the rate up 20% once you are in. Working with the right insurance company is important. Again, an agent can help you with this, and this matters because of the exception of 12 states. Once you are on a Plan G, it is not always easy to move down to a lower cost Plan N that has the lower coverage. We do see people get priced out of their supplement plan because premiums started at $150 per month, and they're now $500, $600, $700 per month, and just unaffordable for someone who is retired on a fixed income. Often these people are left with no choice other than to go to an Advantage plan because their state is not one of those that allows switching plans, and the carriers in their area won't allow it either without medical underwriting. All right, that's two of the three drama spots for supplement plans. Now for the last one. Remember at the beginning when I said that everybody wants the coverage of a supplement plan, but the cost and the perks of an Advantage plan? Well, those perks are the third drama with supplement plans. Supplement plans only cover the gaps of original Medicare. That's Part A and Part B. You do not have any prescription drug coverage, dental, vision, or hearing coverage with a supplement plan. You have to purchase each of those separately, which adds to the dollar amounts that I was discussing earlier. Going back to our Honda Civic analogy, if you want better tires or a better stereo or tinted windows to keep the sun out, you need to get those separately. Same with a supplement plan. Where this actually requires more thought, as silly as it sounds, is with your ID cards. With an Advantage plan, you only have one ID card. You don't even need to carry around your Medicare card if you don't want to. With a supplement plan, you need to carry around your Medicare card, your supplement plan card, a separate prescription drug card, a separate dental card if you get a dental plan, a separate vision card if you get a vision plan, a separate hearing benefit card if you get a hearing benefit. It's a lot of cards to keep track of, but based on the first three things that we discussed, I don't know that having a lot of cards should turn you off enough to not consider a supplement plan. So there you have it. Supplement Plan G is as boring as you will see in any insurance plan, and we love it. Hopefully I didn't put you to sleep. Even with the simplicity of a Plan G or any other supplement plan, always use an agent to help you. It doesn't cost you anything to use an agent, and they can help you navigate all of those drama pieces that we mentioned earlier, as well as guide you through the insurance companies that don't have a history of crazy increases. Even if it's not us and it's one of our competitors instead, please use an independent agent who represents both supplement plans and advantage plans with several different insurance companies. So again, if you have this person in your life, please use them. If you don't, we're always happy to help. And if we can't because we're not licensed in your state, we have excellent partners that share our same philosophy, and we can introduce you to them. Hey, if you found this video helpful, it goes a long way if you will click that like button. If you'd like to see more of our videos on Medicare, subscribing is a great way to stay up to date and support our channel. As always, I appreciate you and thank you for watching.